Hello, my name is Joshua Hughes, and the purpose of my podcast is to educate medical shift workers on the dangers associated with shift work and sleep health, while simultaneously providing tips on how shift workers can intervene their sleep habits to diminish the negative effects associated with shift work and sleep health. Sleep has long been connected to a variety of general health measurements, things like mental health all the way to more physical health like weight gain, diabetes development, heart diseases, and even cancer. While mental health has been known to have extreme effects on symptoms for depression, anxiety, and stress. Personally, I plan to work in the medical field, and so it's very important to me that the people working in that field have healthy sleep habits and have a healthy lifestyle. By controlling sleep habits, medical shift workers can improve and restore their sleep health to healthy levels. Firstly, I want to discuss the dangers associated with shift work and why it's related to sleep in particular. And then I will go into the various ways that shift workers can intervene their sleep habits to improve it. According to a 2014 study that investigated American and European shift workers, 15 to 30% of the workforce engages in shift work among the two countries. In Europe in particular, 19% of the population is involved in shift work that covers at least 2 hours during the night. They define the night as 10 p.m. to 5 a.m., meaning that roughly a fifth of the country will work at minimum 2 hours of their shift between the hours of 10 p.m. and 5 a.m. A shift work sleep disorder occurs in about 2 to 5% of workers and is characterized by excessive sleepiness for at least a month period or sleep disruption associated with an atypical sleep schedule for at least a month period. Sleepiness tends to occur during the night shifts, reaching its maximum at the end of the night. During these hours, impaired performance and vigilance occurs, compromising the health and safety of the individual as well as the patients that they oversee. This also causes randomly falling asleep during the nighttime shifts as well as falling asleep during crucial events in the day, such as when they are driving to and from work. The mere presence of increased sleepiness and fatigue during these atypical hours and during working hours have significant and immediate effects. A meta-analysis compiled 38 studies investigating shift work and general health, and they found the following correlations: a significant link between shift work and vehicular accidents, a link between shift work and type 2 diabetes development, a link between shift work and weight gain, a link between shift work and coronary heart disease, a link between shift work and the occurrence of strokes, a link between shift work and the development of cancer, a link between shift work and the development of cardiometabolic diseases, a link between shift work and cognitive impairments. The study also concluded that all of these effects are similar in nature and degree of effect to sleep loss, meaning that these correlations can be attributed to the effect of sleep loss experienced by shift workers. Essentially, the effects that they see are the same effects that they see if a normal worker were to be having difficulties with their sleep health. And they're also able to associate that shift workers have difficulty with their sleep health. So because of these two associations, they were able to conclude that all the preceding correlations were due to the harm to sleep health that shift workers experience due to the shift work itself. The first intervention I would like to discuss is controlling light exposure. Firstly, it's important to understand the role that light exposure has on sleep. In our brains, we have this internal clock. It is in a region called the suprachiasmatic nucleus. It controls our levels of sleepiness and arousal. It does this through a neurotransmitter called melatonin. Melatonin, many people will recognize from these pills used to help induce sleep. And while most sleep scientists don't recommend the use of these pills, it's important to understand how it works. Natural melatonin is secreted as at night to help induce sleepiness. When melatonin is muted, that causes arousal in the brain. Melatonin's effect on the brain is suppression. It calms down activity to help cause sleepiness. So when you reduce melatonin, that ends up helping wake you up. The simplified version of how light interacts with exposure or with melatonin secretion is that light exposure, specifically blue light, will reduce melatonin secretion in this internal clock region of the brain. Typical recommendations for normal workers and not shift workers involves getting up early in the morning, getting natural sunlight exposure to help wake you up, and then reducing light exposure at night. The goal is to try and mimic this pattern for shift workers who have the opposite schedules. So when you wake up in the evening, you'll want to get light exposure even though the sun will be going down. And then when you go to bed, we want to reduce light exposure as much as possible to induce sleepiness. There was a sleep intervention study that observed 33 nurses working rapidly rotating shift times to see if they could manipulate their light exposure to improve sleep. They observed the nurses over 2 periods. A period ranged from 6 to 8 days. It involved 2 days before the work, 2 days after the work, and the work itself. The work required that the nurses worked 2 to 4 night shifts in a row with changing shift times. The first time that nurses were observed for this period involved no change in their light exposure. This helped them establish baseline levels of sleep. During the second period, an intervention occurred where the nurses were given bright light exposure 40 minutes prior to the shift and were given special sunglasses designed to dampen the light that reaches their eyes with special lenses that reduce light exposure. These were given to them at the end of their shifts during their commute home. The nurses were also given suggested sleep times to help achieve a proper duration during their time off on the intervention period. At the end of both periods, nurses were given questionnaires from both weeks, and they reported, on average, less fatigue, less work-related mistakes, better sleep quality and duration, and an overall more positive mood during the intervention period where they received the light exposure prior to their shift and the special glasses that dampened light after their shifts. Researchers concluded that by manipulating their light exposure, shift workers who have rapidly changing schedules, especially during night shifts, can drastically improve their sleep. A similar study observed night shift workers with the intention of developing an intervention plan. They had 2 groups, a control group where they received no change in their sleep habits, and a treatment group that received full spectrum bright light exposure intermittently throughout the shift, as well as dark goggles that block specifically blue light during their commute home. The study resulted in the control group, on average, having a half hour less of sleep a night compared to the treatment group. This is a difference of 6.6 hours to 7.1 hours of sleep, where the treatment group who received the full spectrum bright light intermittently through the shift and the BlueBlocker Glasses after their shift having 7.1 hours of sleep, whereas the group that had their normal sleep habits received an average of 6.6 hours. Researchers once again concluded that by manipulating light exposure, shift workers can improve their sleep. Now I would like to discuss ways that we can implement tools so that shift workers can achieve these effects. Firstly, I'd like to discuss SAD lamps. SAD standing for Seasonal Affective Disorder. These lamps were designed to mimic natural sunlight exposure of 10,000 lux. Lux is a unit of measurement of light, and a very simple way of testing this is any phone that has a camera, you can download an app. There are various apps. A very simple one to get is called Light Meter app, and with simply pointing the camera in a room, it will calculate the lux count in that room. The SAD lamps were designed for people who live in regions of the world where during certain seasons their natural light exposure is heavily reduced compared to most of the world. This is known to cause a seasonal affective disorder, but it can also be applied to shift workers. Receiving this light exposure after they wake up, which will typically be in the evening as the sun is setting or even after sunset, they can mimic sunlight with this 10,000 lux count, helping suppress melatonin secretion, thus waking them up. There are two items that I'd like to discuss for reducing light. Firstly, blackout curtains in the bedroom. These curtains simply block all spectrum of light from passing by, and thus, when shift workers need to sleep during the day, they can make sure that their bedroom isn't filled with sunlight through windows that could cause them to wake up and would cause them to reduce their melatonin secretion. Similarly, BlueBlocker glasses are glasses designed to block specifically the blue wavelength light. This is the light that I discussed before that's known to have the greatest effect on melatonin. By wearing these glasses, workers will still be able to see during their drive home, unlike how blackout curtains would work. They're able to wear these during their commute home without interfering with their vision or ability to drive, while simultaneously helping prepare their bodies to enter this sleepy state by reducing their light exposure. So in summation, there are three pieces of equipment that they could use to help their light exposure. A SAD lamp to use in the mornings that emits at least 10,000 lux, and they can test this using a light meter app. And then to help them fall asleep, they can use blackout curtains in their bedroom and BlueBlocker glasses after their shift on their way home. The next intervention that I'd like to discuss for medical shift workers is utilizing naps. While in many circumstances naps can be harmful to sleep health, when used correctly, they can actually improve sleep health. Firstly, naps should only last the following three durations: 20 minutes, 30 minutes, or 90 minutes total. These were designed to help take into account the cycles that we go through during our sleep. Without getting too detailed in the sleep cycles and overly complex, what these three times do is they time it so that you'll wake up during a period in the cycle where you won't feel excessively fatigued, while simultaneously allowing you to pass through enough of a sleep cycle to achieve the positive effects of sleep. Straying from these three durations can result in more sleepiness and fatigue upon awakening and will result in harmful naps. A study implemented a scheduled napping protocol for night shift nurses in two separate hospitals. The naps were pre-scheduled to assure that adequate staff was available at all times, and every nap was scheduled for 30 minutes on the dot. The study concluded that napping on the shift decreased the perceived sleepiness of nurses during their shift and decreased drowsiness while driving home, reducing accidents. A separate study performed a meta-analysis where they reviewed 13 studies on EMS shift workers engaging in scheduled naps. They found that the scheduled naps reduced reported sleepiness and fatigue during the shift while improving perceived performance. These 13 articles all had different specific protocols for the naps, different total times for napping, and different points in the shift in which the naps were implemented, and yet together, all of them found the same result. That was naps scheduled on the shift can reduce sleepiness and fatigue and improve performance. Unfortunately, in the case of naps, there's no special tools that shift workers can themselves get. Instead, shift workers will need to argue and push for the implementation of this in their programs. They'll need to talk to management, show them the relevant research, and get them to agree to implementing these naps with the proper times. The next intervention that I would like to discuss is the use of caffeine. Caffeine can be a tricky substance to discuss because while it seems an obvious choice to help shift workers stay awake and vigilant during their shifts, it also has the effect of reducing sleep duration and quality thus worsening the problems that we discussed at the beginning of the podcast associated with shift work and poor sleep. A study involved 58 shift workers who worked either night shifts only or rotated between night and day shifts. They categorized them into 4 groups. One group who took naps and used caffeine, those who took naps and used a placebo in lieu of caffeine, and then the same caffeine and placebo conditions were implemented into 2 groups who did not nap during their shifts. Not only did the study conclude that naps improved, as we had already discussed, their general sleep health, but that the consumption of caffeine compared to placebo improved alertness, performance, and psychomotor vigilance during the shift. This is comparing the placebo and caffeine groups between those who either did not take the naps, thus only comparing no nap group with caffeine and the no nap group with the placebo, and then separately comparing the groups who took naps with caffeine to the groups who took naps with the placebo, thus not allowing the effect of naps to interfere with the comparisons. However, this study did not test the effects of caffeine versus a placebo on the workers' sleep health. Another study investigated EMS shift workers through a meta-analysis of several studies. They found that caffeine consumption improved psychomotor vigilance and lessened the slowing of reaction times that tends to happen near the end of the EMS shifts. However, the analysis also concluded that caffeine consumption impaired sleep duration and quality to a significant degree. It is important to note that as a meta-analysis, the data was taken from other studies that used varying amounts of caffeine at varying times relative to the workers' shifts and scheduled sleep events. Now I would like to discuss how we can implement caffeine to shift workers' schedule to help improve their vigilance on the shift without harming their sleep. Firstly, let's discuss how caffeine works in the body. Caffeine has a half-life of between 4 to 6 hours, which varies between individuals. So if we assume it has a half-life of 5 hours for a particular individual, that means that after 5 hours of consumption of the caffeinated drink, half of the caffeine that was originally consumed is present and active in the body. 10 hours following the consumption of the drink, 1/4 of the caffeine is available and active in the body. And 15 hours following the consumption of the drink, 1/8 of the caffeine will remain present and active in the body. For someone working a more typical work schedule, caffeine is advised to be consumed in the early morning and no later than lunch so as to not harm their sleep. Assuming these normal individuals work a 9 to 5 and get 8 hours of sleep from 10 p.m. to 6 a.m., then having caffeine no later than noon would be the standard recommendation. Shift workers can adopt this approach to their personalized schedules by consuming caffeine directly before or early on in their shift to gain the performance boost while mitigating the effects on their sleep. While the exact timing might vary between individuals and the timing of their shifts and scheduled sleep, the further from the individual's scheduled sleep that the caffeine consumption occurs, the better. The purpose of this podcast is to educate shift workers on how to mitigate the dangers associated with reduced sleep due to shift work. We've determined those dangers to be that reduced sleep can lead to cognitive impairments, which can affect both job performance and the safety of workers traveling to and from their job, as the sleep deprivation causes more accidents. There are other dangers associated with the general health aspects of weight gain, type 2 diabetes development, cancer development, and many other diseases and disorders developing. Shift workers can achieve controlling their sleep through controlling light exposure, taking scheduled naps, and controlling caffeine consumption. So let's discuss how a typical week implementing these interventions might look for a shift worker. Firstly, let's assume that they work the night shift on Mondays and Tuesdays. This would last 7 p.m. to 7 a.m. Then they would have Wednesday off, work the same 7 p.m. to 7 a.m. night shift on Thursday, and then an 11 p.m. to 7 a.m. night shift on Friday with Saturday and Sunday off. This means they have 4 days of work on Monday, Tuesday, and Thursday, Friday, and 3 days off, Wednesday, Saturday, and Sunday. They would work a total of 44 hours throughout the week. For them, I would schedule sleep hours during the days where they have shifts from 9 a.m. to 5 p.m. It's important to have consistent sleep-wake times, so during their days off, I would recommend that they try and stick to this sleep schedule as closely as possible, although I would still say it is fair to allow to shift this schedule a bit so that they can be awake during the day and maybe interact with friends and family. I would recommend that they wake up, they have their blackout curtains in their room to have helped them sleep throughout the day. They would remove the blackout curtains to allow the natural sunlight to enter their room, as well as turning on their SAD lamp or an alternative light source that they have determined to emit at least 10,000 lux. As they prepare for the day and eat breakfast, I would recommend that they consume a caffeinated drink not exceeding 150 milligrams of caffeine. For reference, the average cup of coffee contains about 95 milligrams of caffeine. Thus, the workers should consume about a cup and a half of coffee. I would suggest that this caffeine intake occurs no later than 10 p.m. so as to not harm their sleep scheduled at 9 a.m. At work, I would also recommend having a similar light source to help further increase the awakening effect early on in their shifts. I would recommend that workers can bring this on their own, but should heavily push for the hospital management to implement this for all workers. Although this next point would require hospital compliance and allowance, I'll assume an ideal world where a nap is permitted during the shift. These naps would be scheduled so that they would not have any point in the night where a heavy percentage of the nurses are all sleeping at the same time, reducing the effectiveness. I would recommend that the individual takes a time nap that would last 30 minutes long during their shift, and that these naps occur as close to the halfway point in their shift as possible. In this case, that would be a nap from 1 a.m. to 1:30 a.m. ideally, although having multiple nurses needing to have their scheduled naps occur at different times, this can be altered slightly. After the shift, I would recommend the worker don their blue light glasses when their shift ends at 7 a.m. and to continue to wear those until they get into bed with the lights off, the blackout curtains covering the windows, and they have the intention of falling asleep. It's important to note that their scheduled sleep times should not involve them using screens, so I would heavily recommend that you don't take the blue light glasses off just to go on your phone, laptop, or watch TV. While it's okay to do these activities before bed with the blue light glasses, once you take them off, they won't be able to help reduce the blue light exposure you receive from these screens. And these workers would go to bed with the intention of sleep with the blackout curtains on and no lights in their room, and then wake up and repeat the schedule. This would allow for 8 hours of total sleep time allotted for each day. It would make sure that the caffeine consumption will mitigate the effects on their sleep while still waking them up for their shift, mimicking the caffeine consumption that's recommended for normal work schedules. This would also implement light control protocols that would have them wake up to a light source that would mimic the natural sunlight levels needed to help arouse the person for the day, while also mimicking the light that most workers, non-shift workers, experience at night, the reduced level of light. Although the shift workers will get to experience that during the day by implementing their blue light glasses and their blackout curtains. In the description of this video, I have put links that people can use to purchase all of the described equipment and tools, as well as links to the app discussed, Light Meter, so that they can determine whether or not their light sources have the proper recommended lux count of 10,000 that's needed to have the effect on melatonin, as previously discussed. As well, I have implemented a screenshot of what a calendar might look like with the scheduled sleep times, the scheduled work shifts, and we'll have a detailed description of how they can implement their light exposure and caffeine consumption with the specific schedule